Good day, ladies and gentlemen. From South Africa, I am Daniella Girao, and alongside Dr. Jean Fourie from the University of Johannesburg, we would like to present you the psychosocial support for a prematurely born child with a severe learning disorder. Premature babies are more likely to have a lower intelligence quotient and perform poorly in academic assessments. Additionally, they may experience difficulties in school and require more assistance than children that were born at full term. An impaired neurodevelopmental outcome is a significant long-term complication associated with preterm birth. Any birth before 26 weeks of gestation is associated with a high prevalence of neurologic and developmental disabilities. Prematurity or preterm birth. Preterm birth can be defined as an infant being born before 37 weeks gestation or before 259 days. Severe or extreme prematurity. Severe prematurity or extreme prematurity is defined as an infant born at the gestational age of 28 weeks or less. Low birth weight. Low birth weight is defined as a birth weight of an infant of 2,499 grams or less, regardless of gestational age. Subcategories include very low birth weight, which is less than 1,500 grams, and extremely low birth weight, which is less than 1,000 grams. This case study explored the psychoeducational support mobilized for a Zulu-speaking boy whose premature birth led to diagnosis of a learning disorder. This case study was purposely selected according to specific criteria. Data was collected from semi-structured, in-depth interviews, classroom observations, and medical reports. Thematic content analysis was used to analyze the data. Lebo, who was born at 26 weeks gestation and 14 weeks premature, weighed 500 grams at birth and spent 2 months in ICU. He was 7 when the study was conducted. At home, his mom speaks Zulu and his father speaks Sotho. Lebo attended an English-speaking nursery school from the age of 2 until 5, where he then moved on to an English-speaking primary school. It's at this primary school where his LSAN number was applied for. The LSAN number indicates a mild intellectual disability and that his full-scale IQ falls into the extremely low range. The study was conducted in a low socioeconomic school where therapeutic support is often not available and resources are limited and teachers are ill-equipped to meet the demands of the child. According to DSM-5, the domains of functioning for intellectual disabilities is practical, social, and conceptual. Child development delays can be seen in domains related to motor, cognitive, and linguistic aspects, all which are influenced by biological, psychosocial, and environmental factors. These delays can be divided into 5 specific areas: physical development, cognitive development, communication development, social and emotional development, and adaptive development. The first domain is motor and physical development. Children who are born preterm are at risk for poor motor and physical development. A delay in the development of fine motor skills results in a multitude of difficulties in the classroom. These difficulties include writing skills, having trouble concentrating, and make it difficult for the learner to complete work. This results in written work being slow, rarely finished on time, and often messy and unintelligible. It will also be difficult for the learner to write on the lines and makes letter formation difficult. Gross motor skills may result in the learner having poor self-image and make it difficult for students to participate in classroom and playground activities. This, therefore, affects aspects of development, learning, and behavior. Difficulty manipulating small objects, drawing or tracing, difficulty copying, and poor handwriting are all indicators of a larger problem. Deficits in visual perception have been recently reported in premature and very low birth weight subjects during infancy, childhood, and adolescence. When assessed by a psychologist, it was stated that Lebo had not yet consolidated the letters of the alphabet, days of the week, or months of the year. He could not mention the basic shapes or the name of them, and he had poor letter and number formation. He also incorrectly gripped his pencil and battled to complete a basic task due to this. The progression of Lebo's self-reflection from February to April to May. The first resource that was used to assist with motor control skills was cotton buds and straws. Firstly, the learner was expected to match the color of the cotton bud to the color of the straw, and then using fine motor skills, feed the cotton bud through the straw. The second low-cost resource that the learner used was ice cream sticks with animals. He was expected to build the puzzle and match the animals. A similar resource was the shapes and ice cream stick puzzle. The learner was given all the pieces. He had to sort them according to color and build the shape. This resource assisted Lebo with two difficulties, color and fine motor skills. Fine motor skills to open and close the pegs without snapping them, and color. He had to match the correct colored peg to the correct petal on the flower. To assist with gross motor skills, a spray bottle was used. The progression of Lebo's handwriting, where to commence, he couldn't write the letters on the correct line within the correct spacing, to repeating letters, and finally starting cursive patterns. Writing in different mediums such as salt and shaving cream not only assisted with sensory development but also assisted with handwriting, writing, and spelling. Laminated handwriting pads, which could be used with a whiteboard marker, were used in both maths and English. Learners could trace the letters, practice their handwriting, and practice their spelling. For this activity, Lebo was given a bag of pegs. First, he had to sort them in order, putting them from A to Z. Then, using fine motor skills, he had to put the pegs on the wire hangers. Building on the previous activity, Lebo was given a card with a word on it. Using his fine motor skills and choosing the correct letter, he had to then place the peg onto the card. The next low-cost resource was Coca-Cola bottle tops. The learners placed their bottle tops in a random order in the rainbow shape. When the teacher called out a word, the learners were expected to build their word using the bottle tops. A similar resource to that of the bottle tops, letters were placed on butter beans. The teacher then called out a word, and learners had to build the word using the letters they had in front of them. This activity could either be done in pairs or on their own. Using clear and white plastic spoons, learners would read the word on the one spoon and try and find the matching word on the other. Using two pieces of bathroom plumbing, the teacher created a whisper phone. This allows learners to hear what they are reading, blocking out background noise. This resource reused two items from two previous activities: the spray bottle from the gross motor skills development activity and the cards from the PEG activity. Learners were given each spray bottle and some words. When the teacher called out a specific word, they were expected to spray the word once they had found it. Similar to the previous resource, except this time the learners were given a fly swatter. Once the teacher read out a word, Learners were expected to swat the word once they had found it. This resource uses a toilet roll, where the two-letter blend is stuck onto the toilet roll, while another piece of paper with single letters is loosely placed around the toilet roll. Once the learner turns the loose piece of paper, new words are created which he can then read. This resource uses ice cream sticks and a McDonald's chip box. The sight words are printed onto the ice cream sticks, and learners pull out the ice cream sticks and read the words. Here is some evidence of Label's maths, where he can correctly write the number names and correct number formation. This low-cost resource includes bottle tops. For this maths activity, the learner is expected to sort the bottle tops into ascending order, and next to the bottle tops, place counters according to the number. Reusing the wire hanger from a previous resource, the learner is now given pegs with numbers on them. First, he has to sort them in ascending order, and then, using fine motor skills, place them on the wire hanger. Reusing the pegs from multiple activities, the learner is now given a card with a number on it. Using that number, he has to place the correct number of pegs around the card. This resource uses ice cream sticks with numbers on the bottom and small elastics. Using fine motor skills and the pencil grip, learner is expected to place the correct number of elastics upon the stick. This resource uses sticks and numbered pegs. The learner is given a number of sticks with stickers on them and the numbered pegs. He is expected to count the number of stickers on the sticks and then place the correct peg on the stick. While this resource is a maths activity, it's also used for color recognition. This activity has large ice cream sticks with a magnet and paper clips. The learner is expected to look at the number, recognize it, and using the correct color to match the number, he is expected to place the correct number of paper clips on top of the magnetic strip. Reusing the ice cream sticks from the previous activity, on the reverse side is a number line. Learner is given a peg with a number. On the number line, there is a number missing. He is expected to find the missing number, find the missing peg, and place the peg on the ice cream stick. As seen in one of the English activities, this activity uses clear and white plastic spoons. These spoons either have the number symbol and the number name, or an addition or subtraction sum with the answer. The learner is expected to match the spoons. Children who are born prematurely and have a low birth weight are at risk for many medical complications that could impede later development in areas such as communication. Communication difficulties relate to receptive language and expressive language problems. Receptive language is the comprehension of language. Learners with this difficulty may have problems with the following: understanding what gestures mean, following directions, answering questions, identifying objects and pictures, and taking turns when talking with others. Learners may also have difficulties with retelling of events. Expressive language is the use of language through speech, sign, or alternative forms of communication to communicate one's needs, thoughts, and ideas. Asking questions, naming objects, using gestures, putting words together into sentences, and using correct pronouns may be symptoms of a difficulty in expressive language. Difficulties in this area may result in poor socialization skills. Some of Lebo's communication difficulties. Lebo is exposed to 3 different languages: his mother, who speaks Zulu, his father, who's Sotho speaking, and English at school. His language is very concrete. Lebo has a fair understanding of basic Zulu, Sotho, and English. However, he speaks very clearly and can relate to personal experience. But when given a specific topic, he can only relate to what happens at home and cannot speak on the topic. Here is some evidence of labels, very concrete sentences. To assist label with consolidation of number names, days of the week, and months of the year, the tri-language posters were created. Months of the year, days of the week, and number names were all written down in English, Zulu, and Sotho. Thirdly, social and emotional development. Very preterm birth has been associated with an increased risk to develop social emotional problems. Children who are born severely premature also have more social difficulties. Children with disabilities such as physical, developmental, intellectual, emotional, and sensory disabilities are also at an increased risk of being bullied. A person with MID is at risk of being manipulated by others. Labels, social and emotional difficulties. Label plays with one learner in the class, and when that learner is absent, he becomes very withdrawn. He tends to follow this learner around and follows through on whatever he says. While there's a risk of MID learners being bullied, Lebo is not. He is very small for his age, and due to this, the class is very protective of him. This resource, an old home phone, was used to assist Lebo with the limited friendships and inappropriate social behaviors. Another resource used for the teaching of conversation skills was a plastic toy cell phone. The final resource used to help Lebo was finger puppets. This could either be done on his own or with a friend. Finally, adaptive development. The adaptive function is considered an integrated ability of cognitive and motor skills, as well as an emotional regulation that reflects functional performance. An individual with MID may function age appropriately in personal care, but individuals needed some support with complex daily living tasks in comparison to peers. Difficulty manipulating small objects, trouble learning to tie shoes and button shirts are all indicators of a larger problem. Feed self with little spilling and undresses with no help are self-care milestones that should be reached between the ages of 24 to 30 months. Some of Lebo's difficulties within the adaptive development domain was the inability to feed himself and get dressed and undressed. Before the teacher's intervention, Lebo's grandmother used to feed him and get him dressed and undressed. The educator was also required to instruct him in the use of cutlery, as he ate with both his hands, resulting in a mess around his table. An adaptive board for the classroom was creatively designed and made by one of the grandmothers. This board included belt buckles of all different sizes, buttons from left to right and right to left, shoelaces, and zips, amongst other things. In conclusion, through stimulation and good teaching, no matter the disability, an improvement can be seen, and every learner has an underlying potential to learn. From myself and Dr. Jean Faree, thank you for listening.